Okay.
Okay. So continuing on here, why do you enjoy learning about the heart specifically?
Okay, heart is the most vital organ in the body, and it's four chamber. It's interesting, four chambers, but it has a lot of disease. So you can say viral infection can affect the heart. So it's a vital organ. It's never stop, and we have to keep our hearts healthy and non-stopping to survive longer. So it's really interesting. So I love to open those secrets with the disease and solve them and get diagnosis, and then the doctor will put his management.
Uh, Tell me about the benefits of the facility at South Suburban College. What was so good about this room in here at South Suburban College?
Actually, you can say, okay, let's start again.
Sure.
Okay. The best facility here, you can't tell a range of facility. First, the staff, faculty, they are great. Second, the scanning machine are enough for many students, and also the group discussion. Sometimes our instructor assign us for group discussion even after the class, and this helps a lot. And it helps a lot to master the scanning and master the class of materials.
Why is it so great to actually have the machinery here at South Suburban College?
Actually, because the doctor or our instructor sometimes needs to explain certain disease in the heart. Sometimes the PowerPoint is not enough. So he can take a break at that time and go to the machine for 5 minutes and show us directly and lively, okay? And then after that, we can return to the class. If the machine are far away from our class, I think it's time consuming. It's a good idea to have the machine here.
And then, why was it great to be able to? Well, we kind of already went over that one. Can you tell me a little bit more about Zuber and how he impacted your education at SSC?
Okay, Dr. Zuber, he is a really great guy. He's really passionate, listen to our concern, and usually simplify the class materials to us. And he's a really great guy. He make everything simple for us and always motivate us to study and to scan and show us the mistakes that sometimes we do and correct and guide us how to correct those mistakes.
Do you have to get a license in your field? If so, how did Zubair help you to get your license?
Yes, and he during the study he told us to go to do the first part of our board exam, and it's mandatory to get registered. And this board exam will open opportunities for work. So during the echocardiogram, I did the first part, and he was really a great impact on me to do this exam. So I did it, and once I graduated, it just left one part. Then I did it after. So I feel like when I get my board, it opens a lot of doors for me. For example, works opportunity.
How long have you been working at the hospital that hired you after your internship?
Since May 20, 2018 till now.
Can I have you say, I've been working at the hospital since May 20th, 2018 until now?
Okay. I've been working since May 20, 2018 till now.
Perfect. Let me just flip my sheet over here. Um, this was one of my favorite things that you mentioned to me on the phone was the story of the patient that you helped, where you really helped the doctors diagnose what was actually wrong with him. Can you tell me the story of the patient that you helped, where you feel like you made a difference in his life?
It's thrombus or what?
You said it was you scanned a patient who had a clot in his
Clots,
lung
thrombus,
that
yeah.
was diagnosed, and then he ended up being diagnosed with a pulmonary embolism.
Yes.
Can you tell me this story?
Yeah. One day I took order for patient to scan in ICU because he has shortness of breath. So they treating him as pneumonia and they giving him antibiotic. So I went there to scan the patient. Then I discover clots in his pulmonary trunk, that the artery who supplied the lungs. And it was really interesting because it changed the management 180 degree, because we have to put, the doctor should put the patient on anticoagulant or an thinner medication. So I was happy because the doctor was able to save the life of the patient. And within 3 or 4 days after, the patient really totally improved and no more shortness of breath. And it was really great, successful. And I was happy because it's first time for me to diagnose thrombus in pulmonary trunk.
That's awesome. What kind of things have you done since then? Have you been able to diagnose or help diagnose?
Yes, yes. And I saw also many cases of congenital heart disease in adult, like something called fistula in between pulmonary trunk and aorta, because when I throw the color through the pulmonary and there is some blood abnormal way. So it's interesting for me, but I wasn't pay attention till I see the doctor report suggest there is possible fistula. And it was really amazing because I saw that abnormal thing, but I wasn't curious. But when I see the report, the doctor made the diagnosis. So this is kind of something makes me also happy because I didn't miss it. I provided. Yes, I didn't know what's going on, but the doctor say, hey, you did right, and this is the abnormality.
How do you feel when you're able to provide information like that?
Actually, it keeps me motivated to get a nice picture with high quality. At least something helps in the diagnosis and management of the patient. I think it's the very important part in scanning.
What is your favorite part about scanning?
Favorite part is seeing the heart healthy. I don't like to see the heart abnormal, but if I see abnormal, I have to take care. And this is keep me more focusing and more motivated.
Can you tell me some good characteristics of a good echocardiographer? Like they should pay attention to things, they should be on their toes. Like, can you give me some examples of what makes a good echocardiographer?
What makes me good? Okay, I hope I'm good, but let me say an echocardiographer in general. He should be on time, okay, and explain the procedure to the patient in detail, what's going on, and what part of chest he will expose, especially with female, and also cover the patient, and also make sense about the room. Is it warm? Is it cold? This is very important because you expose the body, the upper part of the chest. So we don't want the patient feel like cold, especially in winter time. And cover the chest good. The second, also explain the patient. If he asks questions, explain to him, I can answer your question, but with limit. I can't provide you everything or diagnosis because the doctor is gonna go through the picture and finalize them. Third, you have also during the echocardiogram, during the session with the patient, be gentle. Address if he in pain or in certain position. Try to manipulate your scanning and hands gently with him, and put the patient on the position that he or she feels comfortable with it. And at the end, tell him thank you, and I'm gonna provide your picture to the doctor. Just keep him updated and when he will get his report and what he should do. In the meantime, if the echocardiographer sees something critical or alarming during his scanning, he should stop and call the doctor right away, because sometimes it's emergency and makes difference, and sometimes will save the life of the patient during the scanning. And another thing, finally, the echocardiographer should love his work to master scanning. Second, help people to get improved from their disease. And that's it.
That was a great answer. You guys want to stop and start again?
Yeah.
One more time and we should be good.